This is a check made out to the U.S. healthcare industry, and while the value of the check keeps increasing every single year, every healthcare debate in the United States boils down to one thing: who signs? Insurance companies, individuals, or the government? Whenever we discuss healthcare in the United States, the conversation always goes in one direction. Who's going to be responsible for paying claims? Today, the U.S. healthcare industry is largely paid for by self-funded employers and insurance companies, but in large, it's privatized insurance. The Affordable Care Act made access a little easier with some subsidies, but as costs have increased, the affordability is all but gone. And in the last couple of election cycles, we've heard a lot about Medicare for all or a single-payer system, a system where the government pays all the claims for everybody. We are so busy on figuring out who is going to pay the claims that we haven't addressed the major problem: the size of the claims. The three most recent healthcare plans that we were probably familiar with are Trump's most recent Great Healthcare Plan, where we're taking money and handing it directly to the consumer via a health savings account, so that individuals have the money to decide what care they pay for, whether it's an insurance plan or paying directly for the care themselves. The Affordable Care Act provided a health insurance marketplace where premiums were subsidized based on income level and other demographic factors. But in all, insurance companies were still paying the claims. And a single-payer system. In the systems that have been talked about in the United States, that is a government-paid system. But in general, this type of system means one entity is paying all the claims for all people. If we dive into the single-payer system, I think it becomes pretty clear how it lowers costs for people. If only one entity is paying all the claims, they have all the U.S. healthcare buying power. They can essentially fix prices. If a provider group or a hospital doesn't want to accept that price, they don't get their claims paid. Without proper checks and balances in place, this type of system can become a slippery slope for long wait times and decreased access across the country. On top of that, doctors will have to rebudget for the new payments that they're going to be getting. Additionally, this healthcare still has to be funded in some way, and it'll be funded via taxes. Costs don't go away, they're just shifted somewhere else. The way healthcare is paid for would have to change. We can't have the government controlling the pocketbooks of all of our doctors and potentially determining care decisions because they're the ones paying for it. Instead, you'd have to provide autonomy for the doctors to provide appropriate care, and they would have to be paid accordingly for that appropriate care. But the government would have all the power, and so you really would need a substantial set of guardrails to ensure that this type of system can sustain. Trump's plan and the Affordable Care Act actually operate under the system that we have today. But there's one major difference. Today, we're shoppers in the U.S. healthcare system, and there are two large negotiators: the U.S. government via Medicare and Medicaid, and insurance companies for private insurance. Under Trump's plan, you put money in the hands of individuals and they go and seek care directly. You become the negotiator. And as individuals, we have very little power, if any at all, to be able to negotiate on the basis of price. Under the Affordable Care Act and the system at large today, the insurance company is the negotiator. And while it's somewhat segmented, they're able to negotiate okay, but for the most part, when they can't negotiate properly, they just pass it along to you in the form of premiums. In reality, we've been debating these models, especially recently with Trump's Great Healthcare Plan and the Affordable Care Act. But while we argue about access for around 20 million people in the marketplace, over 150 million people are insured by their employer and are not as affected by those changes as one might think. As costs continue to increase, they're increasing across the board for everybody. And so these systems are starting to intermingle with each other because employer health coverage might become too expensive. It might cause somebody to waive and go check the marketplace, but marketplace coverage is also very expensive. And so you end up just with this situation where people are uninsured because costs are too high. Unfortunately for us, those 150 million plus people that are in employer plans don't see the total cost of their plan very often. It's much more hidden. If you have a generous employer, you might never think that healthcare actually costs that much. If you have an employer that's struggling with their healthcare costs, like many individuals are, you're going to be very aware of the increasing costs in the market. In all cases, and even in the single-payer case, if you don't address the underlying cost, you haven't done anything. Costs are increasing rapidly because of misaligned incentives in the system, not because we're funding it the wrong way or the right way. And so these three systems, the Affordable Care Act, Trump's Great Healthcare Plan, and single-payer, try to manage cost in these ways. The Affordable Care Act tries to make premiums more accessible through subsidies in a marketplace. Trump's plan gives money directly to the consumer to create competitiveness in the market on the basis of price, and a single-payer system tries to make price irrelevant by setting it itself. None of these plans work if price isn't addressed first and foremost. Whether money is coming from an HSA, an insurance premium, or taxes to fund a single-payer system, it's all coming from one place: your pocket. And if we don't address the issue of price in the U.S. healthcare system, we're going to continue paying. It's going to continue getting worse. It doesn't matter who's paying it. we're all paying it. So I'll close with this. Changing who pays for U.S. healthcare is just changing what pocket the money is coming out of. You can either take it out of your right pocket or your left pocket. You can either hand the money to somebody else to then hand to the cashier, or you can hand it to them directly. But it doesn't matter if they just keep jacking up the price. The money is the money. There's room for all of these things to operate in harmony. They're not operating in harmony today, but I think we need to all step back and address the actual issue in the room. Healthcare is not paid for in the right way today, and until we can align how it's paid for, we're going to continue arguing about who's signing the check as the price keeps increasing. And one last note, people like to feel protected by their healthcare coverage. My personal opinion is that this notion of having choice is more directly tied to how much healthcare costs today and how much the options for protection cost. At a lower cost, I think people wouldn't feel like they want to just pay for what they need. At a lower cost, I think people would be more willing to protect against the risk of bad outcomes. That's my personal opinion. Let's fix the price. Drop a comment on what you think. Subscribe if you like the content. I'll see you next time. Thanks.